In this video, we will go over the different triggers or causes of TMJ or TMD, otherwise known as temporal mandibular joint disorder. Once we understand all the different triggers to help you find which triggers are setting off your TMJ symptoms, then we can find an appropriate remedy. This is one of 3 videos on TMD, and this information will make most sense if you watch those other videos as well. I'm Rick Buck, and I've been a dentist for 15 years, so like and subscribe if you have teeth. I quickly want to start this second video on TMD with my background in TMD and a disclaimer for this video. You see, as a dentist, I see more than the average amount of patients with jaw pain because I am one of only a few dentists in my area that offers botulinum toxin or Botox for jaw pain. So patients will seek me out specifically for TMJ relief. That said, Botox is actually one of my last resorts for treatment. In fact, when I started seeing more TMJ patients, I would have extensive conversations with my patients to help them get to the bottom of their problems to hopefully solve the root cause of their pain without treatment. From these conversations, I soon discovered some commonalities that seemed to be very clear were associated with TMD. Most of them were already well researched, but with others, I could find no literature online or anywhere. In fact, sometimes I found advice contrary to what I was seeing helped my patients. So my disclaimer is that while I'm going to give you lots of well-researched and documented possible causes or triggers that set off TMJ pain, a few of them are not researched. In fact, they are natural conclusions from what I have seen in consistently helping my patients get better from their TMJ symptoms. But that being said, like for my patients, I can possibly offer you more advice than you can previously find anywhere on the internet for that matter. If you watch my first video on TMD, you know that there are certain mechanisms with which your body is equipped to manage and warn you of malfunctions in the body. When those things go wrong, each mechanism kicks in and will produce corresponding sets of symptoms, likely some of which you might be experiencing now for your TMJ. This video in turn will show you many possible triggers that set off those mechanisms specific to your TMJ and its symptoms. So for yourself, once you understand the triggers that set in motion the mechanisms producing your symptoms, only then can you find all the correct TMJ remedies that apply to you. You see, some dentists out there will just try and make you a night guard to correct your TMD. But if that isn't specific to your triggers and mechanisms, you will likely still have symptoms and can possibly make things worse. While this video isn't specifically about remedies, it will have a few, but more remedies are in my next video. So let's get started. Clenching and grinding, otherwise known as bruxism, is the #1 trigger of TMD. It can set off any of the mechanisms we covered in our last video, like muscle, TMJ, and tooth ligament inflammation. Now, if you want that to make sense, once again, make sure you watch my video after this one. But I know what most of you are thinking. I don't clench my teeth. Know this, that is what everyone says. It may be that clenching isn't your trigger for TMD, but what is funny is that most people clench their teeth at night when they sleep, at least a little. Some people do it more than others, and then you will also do it more at certain points in your life. While most of us clench and grind at least a little bit at night, there are others that do it during the day too. What we want to find out is if you are clenching excessively, and then if you are, what is causing an excessive amount of clenching? Like everything involved with TMD, there is no one answer to that question. What I can tell you is that when your body senses hormonal or mineral imbalances, for some reason, your jaw muscles respond by clenching more. So let's talk about those possible imbalances. Stress is an obvious imbalance that causes people to clench their teeth and is very well documented and known. Most people know about stress-related teeth grinding. However, I find that people, including dentists, use that as a scapegoat for why all people are clenching when there are definitely other factors. In fact, I think there are other more common factors. Some diets and exercise programs also cause imbalances that will cause clenching and grinding for some people. I have found this especially true for exercise programs that push you to the point of exhaustion, so you should pay attention to how intensely you are working out, and if you need to, lower the intensity for a while. Also pay attention to your diets. While some are great to avoid junk food that your body does not need, others may be void of what your body does need, causing you to clench. Moving on, some medications, even if necessary, can cause clenching as well. A lot of times antidepressants like Prozac will cause clenching, and this is well known. But I am sometimes suspicious of a lot of other drugs out there too. For example, Afrin. I feel like for me and for some other people, it causes their jaw to clench when they take it. As a last resort, sometimes I will have my patients ask their doctor if they can switch meds or at least lower the dosage as a trial to see if this is triggering their clenching. Now, people that are dehydrated are definitely more inclined to clench their teeth as well. And it isn't just a lack of water that can cause dehydration. Caffeine and other drugs can cause you to be more dehydrated. Sinus issues can also cause clenching. I've seen people going through tough allergy seasons that start to clench their teeth. Or even people with sinus infections start to clench their teeth as well. You normally will know because when the sinus issues stop, so normally does the clenching and the TMJ symptoms. There are also imbalances in your sleep position. For example, people will sometimes use firm memory foam pillows that advance their heads forward too much when they sleep. For some reason, this unnatural position sets off an imbalance that causes people to clench their teeth at night. But it doesn't have to be the head too far forward either. It can be other positions. Normally, if this happens, a bunch of other neck, head, and back muscles will all become sore as well. Why? There are many explanations for why this happens. Generally speaking, all the muscles are overworking to compensate for an unfavorable sleeping position, whatever that might be. So you can always try switching up your sleeping position. Moving on. This may seem counterintuitive, but people with sleep apnea tend to clench their teeth more as well. I have heard it explained like this. When you sleep, all your muscles relax. And for some people, when they sleep, the jaw muscles relax so much that everything falls back and closes their airway. The problem is this lack of air takes them out of a deep sleep, where the muscles become more active and the jaw clenches to try and keep the airway open. It works for a bit until deeper sleep is achieved again, causing the muscles to relax and the whole thing to start again. Oh, and there are a few people out there that are just genetically programmed to clench their teeth more, but I wouldn't think that is you until you've explored everything else too. Before I go on to other triggers of TMJ besides the causes of clenching, I want to explore the last cause of clenching, which is the possibility of taking too many vitamins. I see this so much in my dental practice and can't believe it isn't more widely understood. The main culprits seem to be vitamin D and calcium and some metals like zinc and iron. I haven't seen research on this, but in my practice, about half the people that see me for jaw pain are taking vitamins. Not half my patients, half the patients that see me for jaw pain are taking these vitamins. If they aren't doctor prescribed, I have them stop taking the vitamins for 2 weeks, and about half of those, their TMJ symptoms subside as well. So that's about 25% of the people that see me for jaw pain, not 25% of my patients, that they stop taking the vitamins and their TMJ symptoms go away. Now, I hear this a lot, but I've been taking vitamin D for years, and this problem is recent. All I can say is things change, and when I have them stop for about half of them, the clenching and pain stops too. Now, why the clenching with vitamin D and calcium, and why the jaw? I only have a plausible explanation. You see, there are some muscles that are very essential to survival that you may not think about, but your jaw muscles for chewing are completely necessary. Also, your postural muscles like your back muscles are also important, so you aren't just a blob sitting around in life. It seems these muscles get the lion's share of vitamins that they need to work. It just so happens that muscles need calcium to contract. Well, if they have too much calcium, it appears that they are more likely to involuntarily clench. Even if you don't take calcium, vitamin D helps your stomach so it can absorb calcium. It's an explanation, it's not perfect, and it doesn't apply to everyone, but I would try it to see if it applies to you. In fact, I was first tipped off to this because my wife was having such back pain, so much that her fingers started twitching, and the doctors didn't know what was going on, and she got a bunch of bizarre suggestions. Well, she was on vitamin D and calcium. She stopped taking those, and eventually the twitching and all the back pain subsided. I thought, the back joints and the TMJ are somewhat similar. I wonder if this affects my patients and even me. So I stopped taking it, and my clenching eventually subsided. So then for my patients, I had them stop taking it to those that applied, and it happened for about half of them, it started helping. So I just wonder how many people have TMJ pain and also back pain because they're so similar, because they're taking too many vitamins and they just go throughout life and they get all the doctor treatments and they could have just stopped taking too many vitamins. Before I go on to the other causes of TMD, I want to put a plug in for my best daily brushing and flossing routine video. It will show you how to optimally take care of your teeth with all the best products that I have tested out in other videos that I've made. These products include my favorite floss, toothbrush, and toothpaste by far. Okay, so that covers involuntarily clenching of the jaw muscles, but similarly, let's now go on to over chewing, which also is using the jaw muscles too much. Chewing too much also acts just like clenching by overusing the jaw muscles. This most often applies to people that are frequent gum chewers, nut eaters, or people that chew lots of beef jerky. I remember one patient of mine didn't believe him eating nuts was his problem until I had him stop, and then all of his jaw issues went away. He went back to chewing nuts because he loves them, but at least at that point he knew that chewing nuts was causing his problem. But also excessive gum chewing and beef jerky and things like that can also cause TMJ. Next we move on to jaw injuries. It might seem pretty obvious that jaw injuries will cause TMJ. Most of the time it will do this by triggering TMJ inflammation and or dislodging the TMJ capsule, so that you would likely get symptoms related to those. And you can watch that video if you want more on that inflammation, but you have a joint up there and it messes with that joint is what I'm saying. Now I say injury, but it doesn't take a bar fight with a fist to the jaw to have an injury to the TMJ, because it can be as simple as just a yawn that overextends the jaw joint, or just opening your mouth too wide for a big sandwich. Like most injuries, TMJ issues can be temporary, but a poorly cared for temporary injury can lead to a longer term injury. Make sure you see your dentist if you have injured your jaw. A more likely form of injury and cause of your TMJ symptoms, however, is just having your jaw in an unfavorable position for too long. Here are some ways that this commonly happens to people. Sometimes you can sleep on your jaw wrong or rest your head on your hands for too long in a certain position, especially if you're doing it every day for some reason. For others, it can be a one-time activity as simple as, making out too long. Unlike those things though, your jaw can also be thrown into an unnatural position from, let's say, past dental work. If you had a filling that is too high and it throws off your bite and you don't go have it adjusted, it will leave your jaw in a bad position and can cause your TMJ to become really sore, as well as even the tooth itself can become sore. But it doesn't have to just be a filling. There's other dental work like braces and crowns and things like that. And how about night guards? Night guards are actually made to treat TMD or TMJ. However, if those night guards fail to put your jaw in a favorable position, it can make things even worse or do nothing at all. Now, one of the things that can be putting your jaw in a bad position can just be that this is naturally what your body decided to do. Body parts shift and change in time, so it may have just naturally happened to move into a bad position. But I never like to assume that from the beginning. I like to try all other things and explore other options before we settle on that. Age and arthritis are two more things that can trigger TMJ mechanisms of pain. Since arthritis is a disease of inflammation of the joint, it is consistent that it can also cause inflammation and pain in your temporal mandibular joint, thus starting TMD. Also, the older you are, the more common TMJ degeneration and jaw joint issues tend to become issues, which if you watch my last video, you know those are distinct pathways that lead to TMJ symptoms. So if you want to learn more about that degeneration, watch that first video that I have about mechanisms and symptoms. Everyone should watch my daily tooth care routine video I have posted now, and I will show you why in that video it is the best way to brush, floss, and more, including using the best techniques. Now, continue to watch my other 2 TMD videos. I recommend to watch the remedies video as the last of the 3 videos. See you there.